colorectal cancers are very high. So this is what we are trying to change. Our vision as Illumina is to ensure that at least we can detect these cancers early. And therefore, by detecting this cancer early, going back to the first stages, we can be able to get the best therapy, we can be able to do effective monitoring, and ultimately improve the survival rates of the patients. So just to reiterate again, our vision is to ensure that we perform earlier detection, we perform comprehensive assessment, sensitive monitoring, and we provide novel treatment that is effective for our patients. So what genomic solutions do we have when it comes to oncology research or oncology work in general? So before we look at that, let's see the evolution of oncology sequencing. So in the past, doctors used to look at one gene at a time to see which gene is linked to cancer. Of course, as you can imagine, this is really time consuming, and in the process of doing so, what would happen is you deplete the samples, and we all know in the lab how resourceful samples are. But now with modern technologies, we can be able to look for different genes, what we are calling, through what we call targeted panels. And if you're looking for more than, let's say, 300 or beyond 500 genes, we do what we call comprehensive genome profiling, or CGP. Of course, the future is to ensure that we can be able to get the whole genome information of the patient, and ultimately to perform what we call multi-omics. We can get further insights by seeing how the protein molecules and the whole genome information is being associated with the cancer. So you can see the explosion of biomarker-driven treatments that has happened in the last 2 decades. So for your information, these are 45 different treatments that have been approved by the Federal Drug Agency in the last 20 years. And what is important, and this is just for lung cancer alone. So the reason why we say genomics is powerful is it gives us this information about this growing list of biomarkers, which is enabling us to perform the precision medication that is effective when it comes to cancer care. So Illumina understands that cancer is a big burden. It's a big deal, actually. And that's why it's not a one entity's responsibility to tackle this burden. So what they have done is they have partnered with different entities, different companies, to ensure that across the spectrum that I mentioned, whether it's risk assessment, whether it's therapy monitoring, whether it's drug treatments and all that, we have solutions across all this spectrum. So what you're seeing on the screen are the upcoming oncology in vitro IVD menu that is under development. And you can clearly tell that we are on a mission to ensure that we tackle this burden in a very comprehensive manner, and partnerships are very core in this journey. When it comes to the research portfolio, we have a quite broad research portfolio, whether you're looking at solid and soft tumors, whether you're looking at hematological tumors, whether you're looking at liquid biopsy tumors. And whatever genomics work that you're doing, the backbone is essentially the same. You do your DNA extraction, you prepare that DNA for sequencing, a process we call library preparation. We perform the sequencing, and then there's a report that is generated from the bioinformatics applications that are there. I'll focus on our partnership with Pillar Biosciences, and the reason why I'm focusing on this is, as you've seen, NGS is a journey, and in my assessment where we are as a country, we can't be talking of big things out there without doing what you call baby steps. And by baby steps here, I'm referring to, we'd rather start with small panels. We target a number of genes as we grow ourselves in this particular journey. And what Pillar Biosciences has enabled us is it has solutions that are enabling us in this journey for 2 key reasons. One is the workflow is very short, number one, because in a clinical setting, turnaround time is of critical urgency. So the workflow that is presented by Pillar is extremely short with several safe stopping points. And it's a workflow you can do within a day, within 6.5 hours. The other reason why this partnership is working very well for us has to do with the fact that there's a proprietary chemistry behind this partnership. The chemistry is referred to as slim up chemistry. So essentially, the solutions that we're offering from Pillar are usually amplicon based. So we perform amplification as we target the regions of interest. So in a conventional PCR, what tends to happen when you do a typical amplification, you tend to have these overlapping regions that introduce a lot of false positivity bias when you're interpreting the results. So there's a proprietary chemistry behind this, where they are able to eliminate these overlapping regions. And you even don't necessarily need to include UMIs, unique molecular identifiers, in your assay. So it's an assay that is very robust, very cost-effective, very short, and it works well when it comes to target and sequencing area. This is how a typical workflow looks like for NGS. You don't necessarily need to do automation. You can do your work manually. The importance of automation, especially in a setup like a hospital where the samples come in high throughput, is you can be able to standardize your operations. Sequencing platform, this is one of the platforms that we are highly positioning in this regard. So something I should mention. So when we look at this platform, what we are looking at is more of a tool of hope when it comes to oncology. The key reason being the speed at which you can be able to do your sequencing work. And of course, we have pipelines to ensure that you are able to generate data and interpret it at the end of the day. I'll quickly talk about our platform. So with this platform, in the context of targeted gene sequencing, all the panels that you can imagine of, you can be able to do on this sequencing panel, on this sequencing platform. It's that robust, in short, that's what I mean. And one of the key reasons this platform is essentially in a clinical setup has to do with, number one, the simplicity of the platform. You don't need to, or rather, our reagents for this platform are coming at room temperature. Why is this a big deal? One of the things, like when I hear people talk about sequencing, is to do with cost. One of the things that elevate cost is the cold chain logistics of shipping some of these reagents. So by having these reagents come at ambient temperature, it significantly reduces the cost of sequencing. The other thing has to do with speed. You can do your run within 4 to 15 hours in a single day. And of course, one of the things that we pride ourselves as Illumina is the exceptional quality of data, courtesy of the XLEAP sequencing by synthesis chemistry. Of course, at the end of the day, you need to analyze your data and interpret it effectively. And in this regard, we have what we call Illumina Connected Insights. So why is Illumina Connected Insights so powerful when it comes to the oncology setup? It has to do with the fact that we are comparing our data to over 55 different databases that are updated in real time. So what it means is the clinical report that you get at the end of the day is reliable and you can have very high confidence in that report. Of course, we provide you with other features like customizations depending on your setup or on your clinical setup. And this is another reason why we ensure that we provide a full ecosystem, end-to-end ecosystem when it comes to cancer care. So back to the question, if genomic is really important and if cancer is really a disease of the genome, why is it that we are not routinely utilizing genomics in the oncology practice? Okay, there are several reasons why. Okay, and this is what we get a lot. Number one has to do with the cost. The cost, we have it covered by ensuring that we've drastically reduced the cost of our reagents by improving the technology. The other reason that the other response we get has to do with sequencing is perceived to be complex. So what I normally say is sequencing is simply PCR with extra steps, because when you think about it, like the Ampricon workflow that I've just presented from Pillar, you're just extracting your DNA, then you target the regions through PCR amplification, and then you just load your material library to the sequence and get report at the end of the day. I think the reason why we don't utilize, or rather why genomics is not being routinely utilized in the oncology setting, has to do with what I would call historical inertia. So oncology is traditionally based on morphology, what you can see, or where is this cancer happening. But I think it's a high time that we shifted our mindset to focusing on what is really driving this cancer. So we shift our mindset from morphology to what we call molecularity. We focus on the genomics aspect of it, and therefore, before I close this, to the policymakers in the room, I think it's the high time that genomics was incorporated in the clinical setup, so that we can really redefine the impact of cancer care together. Thank you.